Let's study the skull from the inside. We divide the skull into the cranial fossas. The anterior side, that is known as the anterior cranial fossa. Middle side we have two middle cranial fossa, and the posterior side, this is known as the posterior cranial fossa. So we have anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. This portion is known as the body of the sphenoid. Yes, that is the body of the sphenoid. And here we have a lesser wing of the sphenoid, and that greater portion is known as the greater wing of the sphenoid. This portion is known as that is the rock-like portion here, as well as this portion, that is known as the petrous part of the temporal bone. What is this known as? The petrous part of the temporal bone. Onto the anterior side, look at this portion, that is elevation, that is known as the crista galli. Crista galli. Then onto both the side there are small foramens, that is known as the cribriform plate of the ethmoid bone. That is known as the cribriform plate of the ethmoid bone. So remember, crista galli, cribriform plate of the ethmoid bone, body of the sphenoid, lesser wing of the sphenoid, greater wing of the sphenoid, petrous part of the temporal bone. Okay, fine. Let's study the most important foramens from the inside, as well as we will discuss from the outside. Remember rose L, from anterior to posterior. Remember this foramen, yes, which is not opening outside here, that foramen is known as the foramen rotundum. That foramen is known as the foramen rotundum. This is the anterior side, this is posterior. Yes. So remember ROS. ROS. As you are able to see that this is also opening onto the lower side, and its shape is a oval shape. That's why it is known as the foramen oval. And here that foramen is the foramen spinosum. And this side, that is known as the foramen lacerum, because its margins are lacerated. And it is basically the junction of the temporal and the sphenoid. That's why it is the foramen lacerum. So remember ROSL, rosal, rotundum, which is not opening outside, means not onto the base of the skull. Then this foramen, that is known as the foramen oval. This foramen is known as the foramen spinosum, and this is known as the foramen lacerum. Okay, fine. Now let's identify those foramen from the lower side. From this is anterior side, posterior side. Yes, that is the body of the sphenoid. Rotundum will not coming on this portion. Yes, so we are able to see the oval. Yes, and then just posterior to oval we have a spinosum, and onto the medial side we have here, that is the foramen lacerum. And remember this portion, that canal which is going and opening into the foramen lacerum, and from that internal carotid artery is passing. That's why it is known as the carotid canal. That canal is known as the carotid canal, which is going onto the foramen lacerum. Then onto the posterior side we have one foramen here, that is known as the jugular foramen. That foramen is known as the jugular foramen. Yes, and this is the condylar process, and just near to that foramen, that is known as the hypoglossal canal. Hypoglossal canal. And this foramen, that is known as the foramen magnum. Let's discuss this foramen again. Onto the base of the skull, identify the foramen oval, foramen spinosum, foramen lacerum, carotid canal, jugular foramen, and this portion is known as the hypoglossal canal. And remember there is another foramen. Here our styloid process is broken, yes, but there is a styloid process is there, and this portion is known as the mastoid process, and between them we have one foramen, and that is known as the stylomastoid stylomastoid foramen, from which the facial nerve is coming out. Yes, stylomastoid foramen. And we have also one opening here, that is the external acoustic meatus. Yes, that is the meatus, external acoustic meatus. That is known as the external acoustic meatus. This is the mastoid process. Onto the posterior side, we have a external occipital protuberance. Here we have a nuchal line, that is the superior nuchal line. Yes, and we also have the inferior nuchal lines, superior nuchal lines and the inferior nuchal lines. Okay, fine.